we're going to, after lunch, be able to come back and everybody's going to be here. We can experience all the technologies, everything that's here until later this afternoon. But because we want to make it available, we're going to have our last presentation with Dr. Kate Dillahunty, just going through the test results that we're running here. I don't know how many people have got tested. If you haven't, you can with Chris. We'll be here all afternoon. But what Kate's going to do is go through these tests and explain the importance of these tests and why they could be a deficiency and some of the symptoms that go with it.
Okay, I get to do the bummer thing before lunch. This is going to depress you like hell, and I apologize for that now, but it's got to be done. Now, firstly, let me just find my clicker. Now, how many people actually had an opportunity to do the WICO? Okay, couple of things, just a little housekeeping. Post lunch, if you've done the WICO and the results have come back, I'm really happy to sit down with you and kind of give you an overview of my interpretation of what's going on with the WICO, and also perhaps some things, some tips and some tricks to improve your scores and how we would do it, in our environment and how we can kind of match it to yours. So if you haven't done it, I would also recommend that you go and see Chris outside. Give him your information. He will then hook you up so you can go online, you can actually take the test, and then he'll get your details, and I'm really happy to call you and just say, you'll get a results, I'll get the results, and then we can kind of talk about, again, what you can do to improve that situation. So the WICO is kind of like a FICO, except it's a health score as opposed to, how fabulous your credit is. And these are the things that we were actually testing on outside. I'm going to take my right, which is on the other side, and we're just going to go through very quickly kind of the ramifications of these types of testing. So for instance, I don't stand still very well, so I want to keep moving. So with dysbiosis, we're talking about the usual deficiencies that we would see, and these are things like bowel toxicity, nutrient malabsorption, the slowing of the gastric emptying. You can read autoimmune diseases, the arthritis, eczema, psoriasis, personality and brain changes. This is by far number one, the thing that I see literally on a daily basis. And interestingly enough, if we actually correct this situation, then a lot of the things that are going on with you actually get better. They really do. So we try to always start here unless there are other more profound issues. I study a little bit of iridology, and one of the things that I see when I look in people's eyes, and I'm getting pretty good at this, is often I see a very, very sluggish colon, and this is one of the reasons why. So the symptoms are constipation, diarrhea. Candida is a biggie. A vast majority of the population, for all kinds of reasons, whether it's lifestyle, whether it's diet, whether it's massive antibiotic taking, whatever it happens to be, often have candida. So this is going to have a huge impact, particularly if it's systemic, on kind of the inflammation of your gut. So gut pain, bowel toxicity, allergies, sensitivities, bloating, gas, headache, depression, all of these things could lead, we'd be looking for a dysbiosis, okay? Digestion, absorption, right up there with another number one issue. Usual deficiencies. It's amazing how many people are enzyme deficient. And we now know there's a lot of information on blood types, and different kinds of blood types handle particularly animal protein better than others. So for instance, bad news for the type A's and the ABs. If you digest meat, you don't have the enzymes to break it down as well as, say, a type O or a type B. So the ramifications of that are you can eat animal products, it's perfectly fine, but sometimes we have to then add the additional digestive enzymes to help you. Not always, but often. So type A's and type ABs are often people that we see who have IBS, or they have Crohn's disease and things like that. So when I'm working with somebody in the clinic, I want to know what their blood type is, and I want to know what their diet is, because I want to know essentially if we've got rotting food in there that we need to clear so we can kind of, improve some of their symptoms. But in this case, heartburn and reflux, bad breath, multiple vitamin mineral deficiencies, inflamed joints. If you're not absorbing, you're going to be a big inflammation ball. You really are. And you're not going to get the goodies that you need. And it doesn't matter whether we try to put them back or not. They're still not going to get absorbed, and you're still going to have the same problem. And let me just say for the record, if you're not addressing some of the, the root causes or the issues with this, one of the things that you're going to find is with all the stuff you're self-prescribing, sometimes I see people who make their situation worse, not better, by taking lots and lots of stuff, but not really knowing specifically what they're treating, or not picking a primary primary source of treatment so we can then, after that, kind of add to the story once we see where the cards fall. So again, anemia, unresponsive to iron. I see that a lot in postmenopausal women who have got iron deficiencies all of a sudden. It's not because of so much, it is partly hormonal, but partly they're just not absorbing. Sleepy after meals, undigested food and stools, and stomach pain. Again, real classics. Nutritional cellular health, well, this is a biggie, and you're seeing this with a lot of the technology that's available where we're really reinvigorating this cell growth and what the cells are doing in your body. Quite frankly, if you're not working on a cellular level, I mean, essentially you're potentially dead. So we have to make sure that right at the base root of this whole story that your cellular health is happening. And so we can be potentially looking at, again, the deficiencies or iron and iodine. That's kind of going back to thyroid. We're often seeing issues with that. Vitamin D, B12, heart disease, diabetes, obesity, high blood pressures. Sometimes if we can fix the nutritional health very quickly, we see the blood pressure just immediately normalize. Osteoporosis, cancers, and again, at the base level with regard to cancers, if we can just improve the situation, if we can oxygenate it. I've seen some of you where we've had a look at your nails and there's a little less oxygenation, you know, that your cardiac values aren't flowing the way they should be, and this is part of it. This is part of improving oxygenation at a cellular level. And again, some of these technologies are amazing at it. I mean, even the water can improve this story at that level, and it's incredibly important. So symptoms, feeling tired, brittle dry hair, ridged or spoon-shaped nails, and that's actually a real corker. If you've got your nails are doing that, then we need to look at the cellular health issues. Dental problems, changes in bowel habits, of course, mood and mental health issues, because you're not absorbing the goodies. You're not getting the nutrients, the dense nutrients that you need to exist. And then easy bruising, slow healing, and a slow immune response. B vitamin deficiency. This is a beauty. A lot of us self-prescribe and take vitamin B. It comes in a couple of different forms. This is one of the least absorbed out of everything I see. Often it's one of the first nutrients or one of the first vitamins I actually take away from people because it's overwhelming their system and it's actually not helping the situation. So vitamin B can be a little intense for your body, particularly if you're not absorbing. So don't just go and take any kind of vitamin B. You need to see what's in it. You need to see how they've, how they've put it together. You need to see that the variances of types of vitamin Bs that you can have access to. And most importantly, we need to make sure that it's in fact the correct one for you. You're absorbing it, you're doing something meaningful with it, as opposed to just excreting it. And sometimes with B vitamins, people can be very sensitive, so they can give them headaches, hives, they can get stomach upsets, and all kinds of things, and often it's from a vitamin B ingestion. So symptoms, fatigue, depression, insomnia, confusion, hypoglycemia, cramping in the arms and legs, which can also be a magnesium situation, learning difficulties, muscle weakness, recurrent colds, and diarrhea or constipation. I will often see the recurrent colds thing in small children who are often B deficient, except I wouldn't necessarily give them a supplement. What I'd probably prefer to do is have a good hard look at their absorption, have a good hard look at what's going on in their digestion, and then trying to get them to absorb better so that when they eat, they're actually just absorbing the goodies from that. Thyroid insufficiency, boy, how much do we see that? And one of the things about this is we're not just seeing it in women anymore. I mean, this is your central control system. We're seeing it in men as well. One of the things about thyroids is that I treat a lot of women who have been told that their levels are correct, they're fine, and in fact, they're actually not. They're so far from not well. No wonder they couldn't lose weight. No wonder they were constipated. No wonder they have poor memory and concentration. And the list goes on. So we really need to address that, particularly you women, but I am seeing it a lot more in men. Often the structure of men in coming with a thyroid insufficiency, though, is often not the thyroid. It's really the adrenals or the liver not behaving, and it's affecting the thyroid. So the treatment protocols tend to be a little bit differently. But again, high susceptibility to, well, actually, let's go up to usual deficiencies, vertigo, hearing loss. Can you believe that? Hearing loss. You can experience hearing loss from having a thyroid deficiency. Neuropathies, Meniere's disease, poor night vision, carpal tunnel syndrome, multiple miscarriages, poor digestion, adrenal issues. If we get a fertile lady's act together with her thyroid, often they just get pregnant immediately. I mean, it can be that simple. Symptoms, high susceptibility to infections, water retention, muscular weakness. Adult acne is a biggie. We're seeing that a lot more. And we're seeing that in ladies that are sort of 40s and 50s, which is rather interesting. Slow wound healing, hair loss is a biggie. coarse or dry hair. The sluggish speech. Again, somebody will come into the office and they're just not articulating. They're not speaking that well. And sometimes, again, the first thing I want to look at is I want to see a thyroid panel test because I want to see what's going on with this. And once we can kind of improve it, invigorate it, fix their diet, fix their absorption issues, they begin to articulate, they don't have the brain fog, their memories are great, etc. Liver, gallbladder. Well, the list goes on for those two things, but basically elevated blood cholesterol, food allergies, all the chemical hypersensitivities, we have to treat the liver, and ergo the gallbladder gets a kick with that as well when we come across those. And I'm coming across more and more chemical hypersensitivities every day. I'm really looking at that with all of the profiling when I look at patients now, because there's often, like more than 50% now, that there's something that could be irritating them on that basis. Acne, fibrocystic breasts, premenstrual syndrome, and then symptoms: belching or passing gas, heartburn, nausea, vomiting, anxiety. So far, is everybody like going, yep, that's me, yep, that's me? Yeah, no, they're all tied in. And again, one of the tricks, or one of the things that is the challenge for me is to figure out what the primary is, because I don't have to treat everything. What I've got to do is be clever enough to figure out, in conjunction with you and what resonates with you, is to what we're going to treat, one, and then sometimes everything else falls into place. It's magic, but it can be that simple. So symptoms, again, if you find that you're, a lot of nausea, vomiting, the anxiety, the mood swings, and all of itchy ears is a corker. That's quite common for people who have liver deficiencies, is itchy ears. Fatigue and sluggishness, and also burning feet. Some people mistake burning feet neuropathy and that sort of thing. It's actually, if we treat their liver, that actually gets better. Adrenal and melatonin insufficiencies, again, the usual deficiencies. Again, when we're seeing this, sometimes I'm going thyroid, sometimes I'm going adrenal, but usually what happens is I treat the adrenal and often the thyroid kind of corrects itself. People think the hair loss is the thyroid thing. It could be. They're closely related in terms of their functioning and how you get your symptoms, but often if we fix the adrenal, again, it's that stress story, we start to see improvements, tendency to inflammation, increased susceptibility to cancers, palpitations, hypoglycemia, and poor resistance to infections. Again, you'll see that come up a lot, the poor resistance to infections. Again, it's usually a singular thing. Once we can kind of correct that, the rest of it comes into play. Symptoms, again, at the bottom, you have excessive fatigue, weakness, confusion, insomnia, craving for sweets. That's a beauty. And coffee. People who have adrenal insufficiencies are looking for sweets. They're looking for coffee. But here's the deal. If you do that enough, and I'm sure some of you have experienced this, you actually find that when you go to get the hit, you go to get the sugar hit, in fact, you crash. So it stops behaving like a hyperstimulant, and in fact, it makes you tired. And that, again, is a great indicator that your adrenals are just overwhelmed. So if it's no longer picking you up and it's actually making you tired, it's likely to be something along these lines. Growth hormone deficiency. The usual deficiencies for these, this is something that typically declines as we get older, but again, with some of these technologies, it's looking like we can pick this one up pretty quickly. But overweight, increased body and abdominal fat, skin thinning and dryness, reduced muscle mass, and low mood depression. So if we can start to change things on a cellular level, we can improve nutrition, we can reduce inflammation, then this is also going to be corrected to some large degree. Symptoms, and again, you see the anxiety or the depression, baldness in men and decrease in sexual function and interest, decreased muscle mass and strength. And what's interesting is, again, we want to be testing DHEA, we want to be testing testosterone and other things to rule out some of these issues. Difficult to concentrate and lack of memory, dry, thin skin, and you usually have elevated triglyceride levels. That's usually a given. And then there's some fatigue or tiredness. Dysglycemia and body comp, usual deficiencies, there's the previous lecture I did, the diabetes, and then excessive appetite or binge or uncontrolled eating. So again, there's a confusion with the blood sugar, and we often then want to look at the pre-diabetic, diabetic potential state. Symptoms, again, kind of adrenal-ish, but we want to look at crave sugar or coffee in the afternoon. And then these things like frequent thirst, frequent urination, headaches, insomnia, shake, all of these things are absolute classic pre or diabetic symptoms. So if you have any of these or a succession of these, this is something you really need to explore. Food allergies, this is the one I spend the most time in. Kind of a little interesting anecdotal side sidebar thing, if up until the age of 10, if you have profound symptoms before the age of 10, so for instance, dairy, if you're just a big mucus ball and it's not happening and you don't feel well and you're sneezing, and before the age of 10, it is likely that we're going to call that an allergy. Post 10, we're really more looking at sensitivities. And I don't know how many of you are finding that as you get older, stuff that didn't bother you before is bothering you now. And that's just an accrued, your body, your immune situation is not as robust anymore. These things are catching up with you. They're creating inflammation, and they're creating all manner of other difficulties. So somebody who has a flare-up of rheumatoid arthritis, I'd be looking at this before I touched them with anything else. I'd want to know what they're eating. I'd want to know the effect that it has on them, and I'd want to know whether their system is robust enough to be able to absorb and do something with it. Symptoms, again, well, actually, the gut and systemic inflammation, dyslexia is a beauty. I mean, we treat children, correct their diets or correct their parents, and then it flows down to the children. We start to see an improvement with that. Crohn's disease, colitis, alternating bowel function, and peptic ulcer, weight issues. The symptoms are vast, but the ones I see the most are the ones listed here. So depression, drowsiness, fatigue, sore throat, I see it all the time, itching, sneezing, sinus pain, hearing loss and sensitivities. Hearing loss, when that is a reported symptom, I am now looking at thyroid, I am looking at kidney function, and I am well and truly looking at food allergies. Symptoms, again, as you can see, recurring infections in children is an absolute, it's a deal breaker. If you've got children or you've got nephews and nieces and you see them coming up, they've got rashes, their nose is running, get their parents to take them, or you take them if they're your children, to somebody who understands this field. Because if we can correct it at an early age, they're not going to get all the associated, and I'm serious, the associated devastating diseases that we're seeing now. We got to correct this early. Connective tissue and vasculature. Again, the usual deficiencies are classic. We would see lupus, we'd see rheumatoid arthritis, kidney damage, heart disease, digestive tract damage, anemia, and hearing loss. Again, you wouldn't think they were connected, but they certainly are. And symptoms for this are very much a general feeling of being unwell. You can't really quite pinpoint it. You just don't feel good. This can be accompanied by increased fatigue and also a mild fever. So we'd be looking at a few other things with there. The cold and numb fingers or toes, swollen fingers or hands or muscle joint, pain, rash, stiffness. And we have to rule out a bunch of other issues with this. But again, there it is. Joint muscle inflammation. Again, osteoarthritis and rheumatoid arthritis. Again, this is all going to go back, by the way, big time to diet. Big time. I mean, for osteoarthritis, rheumatoid arthritis, gout, myelitis, bursitis, tendinitis, I treat this with regard to food. Nutritively, I will start with that. I actually do not get big time into supplements. I want to start nutritively. I want to clean up the gut. I want to reduce the inflammation. And then all these symptoms, generally speaking, tend to go away, or they certainly are diminished. And again, it's quite a long, list of all the goodies that happen with that. Lipid metabolism, metabolic syndrome. I mean, this is a big deal. We're seeing this all the time. People have got the high cholesterol, the cardiovascular disease. All of these things, whether they're down the cholesterol level or whether they're actually hypothyroidism, so we're talking about autoimmune diseases, all of these really come into this lipid workup that we do. And again, weight gain around the waist, high blood pressure, thyroid, unresponsive to treatment, decreased libido, check for diabetes, let's go back to that, check for food allergies, let's go have a look at that. And if we can just look at it as a bigger picture and not as a singular story, you're going to get to the bottom of where you're going with this. And cardiodynamics, again, going back to cellular health, a lot of our cellular health, we're not oxygenated enough, and it's really affecting our cardiodynamics. So usual deficiencies, coronary artery disease, heart attack, the abnormal heart rhythms, and so forth. And these are all the symptoms. So if you're shortness of breath, heavy or irregular breathing, high blood pressure, swelling of ankles, you cough at night, that's an interesting indicator. Dull pain or tightness in the chest, et cetera, discomfort at high altitudes. These are things you really need to go to your primary. You need to get this checked out appropriately. You need to be tested, and you need to just take the cardio story off the list so that you end up being one of the 50%ers that don't actually get a second opportunity to do it, as one of our speakers has already given us those statistics. And then once we can actually rule out that organic behavior and what's going on there, we can then start looking at the more obvious things, again, going back to all the things that I talked about before. And last but not least is kidney and renal. Kidney disease is a biggie. We're seeing a lot of lack of balance of minerals in the blood. People just can't remove the waste, particularly after digestion, because the digestion's not working. Muscle activity and exposure to chemical or medications has a massive impact on kidneys because they're trying to excrete things. And then, yeah, you can read that. Pain in the mid-back region, puffy around the eyes, dark circles. If I see that when people come to visit me, I am now really focusing on two things actually. Kidney, but I'm also looking at food allergies for that. It can be kind of one or the other or both. And that is the fastest presentation I've ever done in my life. Thank you.
Okay, everybody, we're going to break now for lunch. It's right next door down there. After lunch, we've kind of cut the presentation so people can just enjoy all of the experiences we have here. And before I break up for lunch, I want to make a big shout out here for Abbas, who's been phenomenal in getting all this recorded. Thank you. See you guys later.